Namaste, good morning, my dear friends. As you know, coronavirus is a serious and big issue for the whole world as well as our country because there is no definitive solution, treatment, or any vaccination till date. Until that time, we need to delay this problem. We need to prevent the getting infected from the corona positive patients. And in this video, I'm going to talk about how to take care of liver disease patients and why. I'm Dr. Bipin Vibhute. I'm liver and multiorgan transplant surgeon from Sahyadri Hospital, Pune. So first of all, we should know what is coronavirus, what is COVID-19. COVID-19 means CO means corona, VI means virus, and D means disease, and which was found in 2019. Hence, it is called as COVID-19. It is a flu-like virus. It is any flu which we know, which we get an infections like viral infections. It is that kind of virus, but it is very infectious virus, and as any virus doesn't have treatment, only symptomatic treatment we can offer as of now. Secondly, we should know who are the patients or who are the people who are at high risk. Those patients whose immunity is low, means patients with liver disease, with kidney disease, with uncontrolled diabetes, hypertension, with patients who was on steroids, or those patients who are on long illnesses. These are the people who are under high radar for this coronavirus. So next thing, we should know how we get infected ourselves. So there are few ways we get infected through the droplets. Matlab, whenever we sneeze and when we droplets from our sneeze comes out and it falls on you, basically you are likely to get infected if your immunity is low. There are different ways also. Even if you touch to the object where coronavirus, the droplets are fallen down, that also you get infected, or if you touch the infected patients, that is the way you get infected. So possible treatment or the prevention is entirely depends on these basis, and WHO is recently has declared that there has some fecal oral from the food also you might get infected. So third thing is why liver disease patients are likely to be on high radar for the coronavirus. As you know, liver is plays an important role of detoxification, your immunity, your filtration, as well as giving the energy on day-to-day basis. So your immunity, if you are chronic liver disease or any liver cirrhosis, or if you are under treatment for any liver disease, you are under the high radar because your immunity is likely to be lower than the other community or other people. Hence, there is no test or there is no any measurement where we can detect what is your level of immunity. If you are liver disease, if you are kidney disease, if you are any other major illnesses, need to be considered that your immunity is low and you need to take an extra precautions. So fourth thing, what are precautions liver disease patients should take? First and foremost is the social distancing. As I told, whenever they sneeze, cough, the droplets fall down, and droplet anywhere, whenever we simply talk, it falls down within a meter, and whenever they sneeze or they cough, it can go up to the 6 to 8 meters as well. But it is very difficult to maintain a distance 6 to 8 meters all the time, but WHO has recommended that at least you should maintain 2 meters distance from the other person, because 8 out of 10 patients, those who are corona infected, they don't show any signs or symptoms, and we don't know which one is infected and which one is not infected. It is better to take an precautions now, because if we get infected, uh, there are possibility mortality, matlab death ratio is between 2 to 5%. Second thing, you should maintain your hand hygiene as well. So I know there is a lot of difficulty in getting the sanitizers, good quality sanitizers, but soap and water is the best way to wash your hands. There are different ways to wash hands, to cover whole hand. So there are different videos available on YouTube, available on the internet, how to wash your hands with the soap and water. Third thing and most important is the wearing the mask, because whenever droplets falls on you, usually, or whenever there your infected hand, whenever you touch your nose, mouth, cheek, anywhere, they are likely to go in. So whenever you go out, you must wear the mask. I know there is a difficulty in getting mask, but if masks are not available, you can make a mask, a cloth mask at your home also. And if that is not available, you can make an your handkerchief 3 times folded and put a mask. That is not ideal, but if you don't get mask, that is an protective equipment. Fourth and most important is avoid going out. If somebody else can go out to get the some essential things for you, then that's always better. As our Prime Minister told, we should have an Lakshman Rekha, matlab line outside your house. You shouldn't go out. So what it does, it prevents you from touching the objects where the coronavirus has already fallen, or and that gets infected. Fifth most important thing, whenever you go out, avoid touching with the dominant hand, because whenever you go out, you try to press your lift button with the dominant hand, or you open the door with the dominant hand, and that same hand comes to your mouth. So that you should avoid it. And last but most important is keep doing some kind of exercise and eat healthy, because your immunity is not going to increase overnight. So increasing immunity, it takes a lot of time. So eat healthy, eat a lot of vegetables, do some exercise, wake up early, drink appropriate water. And there are a lot of myths among the social media, because of our country is locked down. There are a lot of social media news are coming, drinking hot water, taking vitamin C. A lot of things are coming forward which we can prevent the coronavirus, but these myths are, we have to take with a pinch of salt, and do an proper research, or get an advice, or watch our videos on YouTube. One more last thing I want to just highlight here, because avoid taking unwanted medicines, or over counter drugs, because that will harm you more, like a chloroquine, because Mr. Trump recently tweeted that this medicine might work against the coronavirus, but there is no sufficient data or evidence that this drug will work or not. But to the on safer side, please avoid taking these drugs. You can buy and keep it, because there might be a shortage of these drugs, but as of now there is no evidence that chloroquine works against the coronavirus. But there are some encouraging trials going on in China and United States, but how they work in the liver disease patients, we still don't know, because every drug has to go through the liver to metabolize, to process, and form to the active metabolites. Hence, please avoid. So at the end, I request all of you, please avoid going out, keep a social distancing, mask, hand sanitizer, and use this ample time to with your family, which hardly you get it. Thank you.